I heard some, I guess we'll just call them rumors, that Barry Mills was mistreated in prison. His demise had some uh, nefarious things going on. In other words, maybe the Bureau of Prisons murdered him. Yeah, right. Okay. Um, Let me tell you who we're talking about, and then we will go into very much in depth of what his corpse looked like, all the stuff inside of him, outside of him. I mean, if you, talking about the interior workings of the human body is disturbing to you and corpses, then this is not the video for you, because we quite literally talk about some of him at the cellular level. So just so that everybody knows what we're talking about, Barry Byron Mills, a guy that robbed banks in California and later became one of the three leaders of the Aryan Brotherhood. That's the guy that we're talking about. Now, he was transferred all over the place. I mean, starting in 1976 all the way up to his death in 2018, he never saw the light of day again. And yes, I had personal contact with him. We knew each other. So, all that you can't talk about just because you don't, yeah, whatever. I do. I was there. Now, yeah, I wasn't at the robbery in 1976 in California. I didn't go with him, to all the places that he was transferred to in Lompoc. He served time there. He served time at Lewisburg. He was sent to Atlanta. All this was in supposedly to control him and make him a nicer guy while he was in prison, but it certainly didn't work. I mean, he was stabbing people, ordering people to be stabbed. He really was one of the top three guys of the Aryan Brotherhood. So I have a video which is over a half an hour long, which talks about his career. Let's call it that. His career in the Bureau of Prisons, where he's throwing feces on people and urine on the guards and murdering other prisoners, and given two consecutive life sentences, and on and on and on, where he's going. Now, if that isn't in depth enough for you, by all means, let me know in the comments. I have all this paperwork, and we could go over his crimes and misdemeanors and rule breaking and what made him so bad and why he had to go to Marion and eventually went to the ADX. I mean, if you want to know all of that sort of thing and how he ends up being at the ADX on the 8th of July where he dies. But in this one, we're going to specifically just talk about his death. So, let's do just a little bit of that, and then we'll go into the, what happened. Now, he was in Joker unit, cell number 3. This is at the ADX. And the officer that was there noticed that he was unresponsive during the 10 o'clock count. We make so many counts a day, 10 o'clock being one of them. He notified his supervisor. They called the medical team. They all ran down to the unit. The EMT that was working that day was R. Huddleston. And they did CPR, and they used an ambu bag, tried to do all kinds of stuff to keep him going. And if he'd have been the U.S. president, he wouldn't have gotten anything better than that. Now, so that ends the life of him, but not the rumors. So there was a whole bunch of rumors and stuff, about what happened to him, and he was abused, and there's some kind of conspiracy going on, and that's what this video is going to be all about. But like I said, if you really want to know about the guy and all of that criminal activity and how he was associated with the Aryan Brotherhood and what that all entailed, I have another video and I put it in the show notes. Now, as I said before, there was a lot of rumors about Barry Mills' demise. So I wanted to clear up some of it. So what I did is I got the El Paso County coroner to send me his autopsy. Now, I tried to get the birth certificate, but apparently in Colorado, birth certificates are very secretive because they have personal information like what he died from. But apparently the autopsy is not secret. Now, I saw some other places too where they give out all kinds of incorrect information because a lot of people that are making the videos about prisoners aren't very careful with what they're doing. Like I seen, oh, he died at age 70. That's on Wikipedia. No, he didn't. He died at age 69. Look at his date of birth. August 26, 1948. So he died at age 69 because you'll notice over here we did the autopsy a month, more than a month before he turned 70. So if they were doing an autopsy before he turned 70 and they claim he was 70, then I guess he lived longer after the autopsy, some kind of stupid stuff. He was pronounced dead July the 8th, 2018 at 11:51, and I went over, some of those things there. Now, what was wrong with the guy? Man, he was really old and screwed up at 69. He had lots of problems. I mean, a lot. Now, his focal interstitial myocardial fibrosis. Yeah, that's a really bad heart. His heart's failing. That's what they're telling you there. That's probably the thing that really caused everything is his heart failure, which is surprising to me. I mean, he was an exercise fanatic. This guy was training for the Olympics like his whole adult life, at least in prison. I remember he used to just exercise for hours and hours at a time. Now, this, and I can't hardly even pronounce this, pyelonephritis, whatever the hell. It's associated with urinary retention. What we're talking about there is, and if any of you have ever had a kidney infection, you'll know what I'm talking about. This stuff is really painful and life-changing. So what he had was chronic kidney infections, and the reason for that is he's got this urinary retention problem. So what's happening is that the guy can't pee. He just can't. So he's got to use a catheter and ram it into him and get all the way as far as he can to get past these blockages and then allow his urine to leave his body. And what he's doing is every time he's taking this tube and ramming it into his urethra, he's damaging it. He's causing more trouble. But you got to get rid of the urine. You got to pee. So it can't back up because that causes more problems. And that's what probably happened with this guy here. He had this urinary infections or kidney infections all the time, which caused fever, burning, when he urinates, chills, nausea. I mean, it's just really hard on you. And then of course he had renal failure, so his kidneys finally just gave up. And that's what really killed him, was all these things working in concert. But really it's his heart. He just had a bad heart. Now, down here you'll see other findings: past medical history of traumatic puncture wounds with resultant aphakia. What that means is he got stabbed in the eye because this guy's a violent individual. He's fighting all the time. They're stabbing each other, and he got stabbed in the eye. And there's a part of your eye which allows you to focus on things, and all that got damaged along with the lens. So he's got a real bad eye, and he's just progressively going blind even in the other eye. And so now he's going blind. That's why he wore those sunglasses all the time, or at least that's why they said they allowed him to wear these sunglasses all the time. And of course, just to round things out, he's got this thrombosis in the prosthetic veins. In other words, he's got real bad interior butt problems. He's got veins that aren't working correctly, probably because his heart's not doing the job it's supposed to do. So he's getting things like blood clots and stuff in his anus. It's like, oh man, what a physical suffering this guy must have had his last year or two. It's my opinion that Barry B. Mills, 69-year-old adult Caucasian male, died as a result of focal interstitial myocardial fibrosis and chronic pyelonephritis, I hope you pronounce that right, associated with urinary retention. The renal failure may have also contributed to death. The microbiology culture results are likely due to a prolonged postmortem interval and non-indicative of infection. So they go over his body here, and we talk about, what it's got. Here we go. Randy Keller. I spoke with him. Really nice fellow. He made sure that I got exactly what I was asking for in this autopsy, and he explained to me the laws of Colorado too, about who can get just death certificates and who can't. And he was very, very helpful in getting these documents and stuff. Now, the Bureau of Prisons, of course, they don't know anything. They block everything they can. They tell you everything's a secret, and this is not possible to get this document from them. Even though they have it, they won't give it to me. I had to go to this Mr. Keller, the coroner. But they were telling me at the Bureau of Prisons that it's not even possible to get this stuff because it's all medical stuff. And don't believe what the government tells you. That they lie to you about all kinds of stuff because they don't want to give up any information whatsoever. Because I guess they're afraid we're going to accuse them of something. Okay. Now, the gross examination, that's where they just look at your dead carcass laying there on the table. I said the body is that of a well-developed, well-nourished Caucasian male, 71 inches tall, weighing 173 pounds, and appearing compatible with the stated age of 69 years. The deceased is dressed in a pair of white boxer shorts and white socks. Yeah, so they tried to make him, presentable. Probably, who knows what he was wearing when he died. Now, rigor mortis is present. Livor mortis is found in the dorsal dependent portions of the body. So on the back side of him, he's got a lot of stiffness. The body's cool to the touch. The deceased has white scalp hair and is bald with a white mustache and beard. The eyes are open. Conjunctive are injected. He's got a lot of, his corneas are clear. He's got blue eyes. Right pupil is round and shaved. The cornea is clear. The iris is blue. The left eye has this puncture wound, and the pupil ain't round. The ears and nose and the external auditory canals are unremarkable. The mouth is closed and the teeth are natural. Present on the left ankle is a small indistinct tattoo, which somebody told me that when you get really old, your tattoos start to fade away and get all smeared. So all you people that are, getting these really cool, super neat tattoos, when you're old, it's just going to be smeared and people can't even tell what they were. Now, present in the central portion of the chest are devils riding horses with a helmeted head and a waterfall tattoo. Present arcing across the upper part of the abdomen is a tattoo in German of Weissmacht. Now, these guys think that it means white power, Weissmacht. No, not really. mine Ganza Kraft means with all my strength, so Ganza Kraft would be more like strength. So Weissmacht, it'd be more like Weiss Ganza Kraft would be the way I would have said it, but whatever. And I even looked it up on the translator to make sure that my Southern German is equal to their Hochdeutsch. Anyway, present on the left shoulder area is an indistinct partial outline tattoo. And there's that smearing of tattoos again. Present in the central portion of the back, beginning just below the neck and extending to at least 2/3 of the way to the posterior waist, is a large hooded robed man tattoo. Present on the upper right back is a dog mounting a police officer tattoo. The genital area, including the scrotum, is normal without evidence of swelling and free from trauma. So in other words, nobody is kicking him between the legs or anything just before he died. Present in the anterior aspect of the right arm, extending almost to the level of the volar aspect of the wrist, are 2 swans with flowers and a long-haired woman's face tattoo. Present on the medical aspect of the left arm is the Iron Cross tattoo. Present on the posterior aspect of the left forearm is a prisoner with a ball and chain tattoo. And then we go over all these little tattoos like it matters. Now, evidence of medical therapy. Now, he had an airway protruding from his mouth, and he had these EKG things on his chest, you know, where they tried to monitor his heart, give him air. You know, they did the cardiac shock thing. They did everything they could to, you know, there was evidence they did everything they could to prolong his existence. Now, he does have some injuries. Present on the bridge of the nose is a 1.5 by 1.3 centimeter red contusion. So he got a little bruise or scrape on his nose. Present on the right temple, beginning in the right lateral to the, just lateral to the right lateral eyebrow margin, is a 0.8 by 0.4 centimeter abrasion, slightly posterior and inferior. Present in the back, 2/3 of the way up from the shoulders to the posterior waist, and just to the left of the posterior midline is a 1 centimeter diameter circular abrasion. Present below this and to the right posterior midline is a second circular abrasion. Present on the posterior of the right elbow is a small abrasion. Present on the dorsal, which means the back of the right forearm, is a little red contusion. The oral cavity is without any type of trauma, and superior and inferior frenula are intact without evidence of trauma. The medial and lateral wrists, medial and lateral lower legs, at level of the malleoli, and the soles of the feet are incised when no hemorrhages are found. So no one beat him in the legs, no one beat him on the arms. He's not showing any beating. He's showing maybe he fell down a little bit, like he bumped some things. You know, the inguinal canals are incised, and spermatic cords and testicles are delivered to the abdominal cavity. No hemorrhage or abnormalities are found. Testes are incised and no hemorrhage is found. So they cut his balls open, and nobody had damaged them prior to death. Now, his internal examination, you know, a scalp is incised and retracted. They basically just scalp you and they pull your hair back. No scalp hemorrhages or skull fractures are found. Cranial vault open. So in other words, he wasn't beaten in the head, or he didn't smack his head on anything. Epidural space is free from hemorrhage, so there's no, like, I've heard people say, oh, well, he was murdered in prison, and this is all a big cover-up. Well, not according to the evidence where they cut him all apart. He doesn't have any damage to his head. He wasn't beaten. He might have lost consciousness at some point and flopped over, and that seems to be about it. You know, I mean, there's no fractures found, nothing like that, no traumas. You know, the body, they cut him open with this big Y incision. That's where they start at each shoulder, come to the center of your chest, and then from the center of your chest they go all the way down to your belly, and then they call it a Y incision. The organs occupy their usual positions and relationships. No evidence of infection, tumor, or trauma. on his neck, cardiovascular system, the epidural and endocardial surfaces are smooth and glistening. Myocardium is sectioned and is uniformly firm and homogeneous, beefy red appearance. I always like how they talk about us like food. Beefy, like we're compared to beef. Yuck. Cardiac valves are thin and delicate. Coronary arteries on a cross-section are widely patent and free of atherosclerotic plaque formation. So, whatever. Now, he has one lung that weighs 850 grams and the other one weighs 675 grams. That seems pretty rough. So he's got problems with his lungs. His gastrointestinal system is more or less normal, and his liver is congested, and his gallbladder is unremarkable. Pancreas is unremarkable. Adrenal glands is unremarkable. The spleen weighs 200 grams and capsules smooth and blue-gray on cross-section. It's unremarkable. His kidneys, though, they cross-sectioned them. They looked at them. They collected, parts of them. They don't seem to be all that stuff, but they do notice some pinpoint hemorrhages. So he had problems with his kidneys. Then they do all these slides here where they took sections of stuff and looked at it. Now the examination of his heart reveals good preservative of the epicardium, myocardium, and endocardium, and it seems unremarkable, but it really wasn't working right. So that seems to be his issue. No evidence of inflammatory problems. His lungs have severe acute passive congestion. So he was probably from his heart clogging up, getting harder and harder to breathe. His kidneys, they got that acute focal, and I can't even pronounce it. It's basically he just got kidney infections, and he's been having it for a long time, and it's showing up. His pancreas seems all right. His bladder shows these cysts. So here's all the drugs that they tested him for in his final amount of urine, and nothing is showing. No ethanol. So he wasn't drinking. He wasn't using any drugs, at death. And here's all these things here. They tested his potassium and chloride and glucose and all that stuff. And it all seems reasonably normal for an old, broken down man who's probably got diabetes, butt problems, lung issues, severe heart problems, and kidney infections. But other than that, he was doing okay. So that's should lay to rest all the murder conspiracies, because this Robert Bucks, MD, he's unaffiliated with the Bureau of Prisons, and if the BOP had done something to this guy, this Dr. Bucks could care less, and he would have told on him. But his autopsy of Barry Mills shows that there was no assaults, damage to his body, that kind of thing. He's just an old 69-year-old guy who didn't take care of himself before he went to prison. Now, he was a great exerciser, and he was in fabulous shape that way. But inside, he was all busted up from his years and years of using drugs and fighting people. And he was going blind in one eye and was pretty much blind in one and the other eye. So there's nothing on this whole report that says anything about anybody doing anything to Mills to cause his death. He just got old and worn out and died. Okay, and here's what the Bureau of Prisons said that happened on July the 8th. If you go down here, the fellow, the EMT, Mr. R or Miss, who knows, Hudson, they said, let me zoom in a little better here so we can see this and go up here. This is the provider, R. Huddleston, EMT, Emergency Medical Technician. And the encounter date was July the 8th, 2018 at 9:52. Now, he, she, or it says responded to a medical emergency announcement in Joker unit. Inmate Mills was in his cell with no signs of life. CPR was initiated and he was moved to the medical trauma room with CPR continuing. An AED was utilized and an oral airway was placed. Oxygen was started at 10 liters per minute with an ambu bag during CPR. AMR was notified, arrived, and pronounced inmate Mills expired at 10:34 a.m. What that's telling us is that stuff that was in the autopsy where they said, yeah, there was this tube sticking out of his mouth and he had, the AED stickers stuck to his chest and on the side and all that stuff. That's explained right here where what happened. And then they said inmate expired at 10:34. And yeah, sure, whatever. And this was generated that same day at 11:51. So just like a couple hours after he expired. And, here they're talking about what they've seen and that stuff. Let's go to the next page. And I gotta make it bigger because this thing works that way. Here we go. Co-signed by William Resto. That's the prison doctor there. All this is secret, so you're getting all kinds of secret stuff. That's what they tell me anyway. And then I ended up going through holy hell, and then we get some of these documents from them because they have to give them to me because they're public documents. And here we go, some more. And it was co-signed by the doctor the next day at 7:49 in the morning. And he said, yeah, that's what happened. That's what they do their own little investigation by asking people what happened. And that's kind of where they went. And here's other documents that I have that I use in my other videos, which I'll link in the notes below so that you can see that. So anyway, my point is that the documents from the Bureau of Prisons and the independent documents from the autopsy are consistent with each other. And if you think that there's this mass conspiracy between everybody in Colorado to cover up anything, you're just being ridiculous. And so when you hear all these conspiracy theories and misinformation, you just got it right from the horse's mouth. This is what happened. So he's just an old man, and he died. Now, if you like this, for goodness sakes, don't worry about it. You won't die if you become a subscriber. And hit the like button too, will you?